Welcome everyone. This is Dr. Sultan from Dentistry for Children in Clifton, New Jersey. We will be reviewing tongue and lip ties for infants. For those that don't know me, I'm a board certified pediatric dentist through the American Board of Pediatric Dentistry, a member of the Academy of Laser Dentistry and American Laser Study Club, and a fellow through the American Academy of Pediatric Dentistry. Before beginning this presentation, I would like to acknowledge credit to Dr. Richard Baxter and the Tongue Tie Academy for inspiring to create this video for our patients and parents. So what is a tongue tie? A tongue tie is a too thick, tight, or short remnant of tissue from fetal development under the tongue that restricts normal tongue movement and causes a functional issue. The symptoms the child has are more important than the appearance. A full assessment of related issues is the key to diagnosing a tongue tie. Having a patient stick the tongue out is not the best test to determine the presence of a tongue tie. Elevation or having the patient open wide and lift the tongue to the palate is the best quick test for older children, or lifting the tongue on baby is the best test. Elevation or lifting the tongue is a critical movement for the key activities of nursing, swallowing, and speaking. A lip tie is a remnant of tissue that is abnormally tight or thick that causes difficulty lifting the lip as is required for nursing, feeding, speech, or for cleaning the tongue. It also can cause a gap in the teeth, and if it is wider than 2 millimeters, it may need to be released and will not likely close on its own, especially if another functional issue is present. As I've always said, if it ain't broken, don't fix it. This slide shows the variable appearances of a lip and tongue tie. On the top, you can see the different type of lip ties. On the bottom, you can see the various types of tongue ties. Tongue ties come in all different varieties. Some are more obvious and to the tip, while others are more hidden or posterior. More important than the appearance is the mother's and baby's functional problems and or symptoms. So what are some common issues with tongue ties? Well, first of all, healthcare providers are not taught about tongue ties in medical school, dental, nursing, or graduate school. Some common myths and misinformation about lip and tongue ties are common, such as they don't exist, especially posterior ties because it's harder to see. They don't cause problems with speech, feeding, or nursing, which is not true. Another common myth is frenums will stretch or the child will fall and rip tie eventually. Has happened in the past, but not the best way to release a tie. A quick snip with scissors will fix a problem. Unfortunately, the release has to be a little bit more deeper than that. A baby or child would need general anesthesia or sedation to treat, which fortunately we have not needed that for any of our cases. Many babies have nursing difficulties that don't resolve is a common issue with tongue ties as well, along with speech issues with R, L, S, TH sounds. A child may have speech delay, mumbling, or baby talk. Airway issues are common as well because the palate and nasal cavity is not expanded. Since the tongue cannot rest at the roof of the mouth, it doesn't have the ability to expand. Snoring and sleep disorder breathing is common in kids and adults. Feeding issues like difficulty transitioning to solids, swallowing food, or slow eating, picky eating, and reflux is common. Issues with tongue ties can also cause dental issues in the future, such as cavities, gaps, narrow palates, and braces, and mouth breathing leading to ear infections and enlarged tonsils and adenoids is common as well. So what are some common infant problems related to lip and tongue ties? Some infant symptoms include shallow latch or popping on and off the breast or bottle, poor or slow weight gain, short sleeping and frequent feedings, clicking and smacking noises during feeding, gassy or fussy often, snoring, heavy breathing, congestion, choking, and gagging on the milk. Milk dribbles out of the baby's mouth. An infant is unable to hold a pacifier. As a result, mothers can also have symptoms as well, such as painful nursing, bleeding, blistered, cracked, creased nipples, incomplete breast drainage, infected nipples, mastitis, and thrush, and they can't feed the baby without a nipple shield. Currently, we release the lip and tongue with a laser, which comes with great advantages, such as minimal to no bleeding, less painful than a scissor or a scalpel method, better visualization during the surgery. It's extremely precise. Virtually, there's no risk of infection since the laser has the ability to cauterize any blood. No need for general anesthesia or sedation. It's very effective. Excellent healing and less scarring compared to scissors. We use the highest quality surgical CO2 laser available that vaporizes the tissue instead of burning it like a cautery or a diode laser. And if you would like to see more information regarding our laser, please visit our website at www.dfcsmiles.com/tongue-tie. So during the procedure, we follow all laser safety protocols and use protective eyewear for everyone in the room. We swaddle the infant in a warm swaddle to prevent movement that could make the procedure more difficult and ensure the baby's safety. Parents are more than welcome to be in the treatment room during the procedure, but we do give the mother the option to wait in the reception area if she may feel too stressed to be in the treatment room, so as not to impede milk supply before feeding. The procedure takes about 20 seconds for the lip and 10 seconds for the tongue, and another couple of minutes to set up and position the baby and take photographs. My team will leave the room for privacy to allow family to feed, and we will return after family has opened the door. So for the healing phase, we want the baby to nurse and feed right away. This will help make sure that there's no restriction, give mom some confidence, and make sure that we don't need to do more tissue removal. Oral wound healing is quite rapid, so the scab will turn a white or yellow color after a day or two. It can look like an infection or pus, but it's actually not. Baby may drool more, and we will recommend Tylenol and Motrin for discomfort based on the baby's weight. And you can do suppositories if needed. Another great tip can be breast milk ice chips. If you can place some of those in the freezer, that is a great way to help heal the releases. Nursing, bottles, nipple shields, and pacifiers are all okay. Do what you can to keep baby comfortable and eating well, and work with a lactation consultant or feeding therapist. Try not to change too much else for the baby's sake right away. Normally, your baby will be sore for 1 to 3 days, improvements by day 5. So typically after the release, we will recommend Tylenol or Motrin for the baby. Based on body weight, we will let you know how much the baby will need. Here are a general list of the volumes of the medication that are needed for the babies. As great as the release with the laser is done, post frenectomy exercises are crucial since because of the release, the ability for it to reattach is very common. So the post frenectomy exercises are done to prevent reattachment and re-strengthen the tongue muscles. The exercises need to be done for 3 weeks, 6 times a day. Try to switch it up when doing exercises, sometimes with feeding, sometimes with diaper changes, etc. Keep it as playful as possible with funny noises and faces if baby is older. Play with baby's mouth and tongue when you are not doing exercises to prevent an oral aversion. Keep the actual stretching of the wound to just 5 to 10 seconds for the lip, 5 to 10 seconds for the tongue. Using a camping headlight or have someone hold a flashlight to see that diamond is crucial. That's where you want to make sure that you can see that it's open so it does not reattach. First, lift the upper lip high to the nose so the diamond is fully opened. Then use a gentle massage on the wound to ensure it doesn't grow back together. For the tongue, come from behind. Use 1 or 2 fingers to lift the tongue as far up and back as possible to put tension on the wound and ensure the diamond is opened up. Gently massage the wound backwards using the same rolling massage motion to encourage the wound to elongate. So one common thing I tell parents is that there's always some form of reattachment. The reattachment is simply the natural healing process. Just like a cut on the hand, it will heal back together. The special cut under the lip or tongue will try to contract and heal together as well. We're trying to trick it to stay open. Can happen easily if stretches aren't performed routinely and with enough pressure or tension. Make sure to stretch often, every 4 to 6 hours with sufficient pressure, and look at the site with a light. If it looks or feels tight, do a stronger or deeper stretch to open the scab again. There's a video on our website, or we can perform for you at 1 week follow-up visit. If symptoms begin to return after they disappeared, then this is the likely reason. The release of a lip and tongue tie is definitely a team effort. We can do only one part, but for successful nursing, there are other professionals that can be involved as well. Lactation consultants, for example, IBCLC, is critical with a baby who has been having difficulty feeding. Make sure you follow up as soon as possible or within 24 hours and continue to get as much help as you can until nursing is efficient and comfortable. Speech and feeding therapists, SLPs, can help with bottle feeding or solid feeding issues. Body workers, such as chiropractors, physical therapists, or craniosacral therapists, can certainly help if your body has any neck tightness, such as torticollis or other issues. Finally, pediatricians or PCPs are greatly needed for routine visits, weight checks, and medical issues. As a follow-up, I will have my team call later in the evening to check on you and your baby. You will also have after-hour Mercy line in case there is any questions or concerns. If you have any questions, please let me know or you can call the office. We are currently using systems in our office that can increase communication, so please ask us what system we're currently using. Remember, it's a process. It will likely be better in the office, but could get more difficult for a few days, then get progressively better over a few weeks. Expect one better feed a day. As extra support groups out there, especially on Facebook, you can reach out to New Jersey and New York Tongue Tie Babies support group as well. Finally, thank you for your time and listening for this presentation. Follow for more success stories at DFC Smiles, and please visit our website at www.dfcsmiles.com.